So she is our second med-surg nurse from Fort Lauderdale.
Amazing, right? So, Yvonne, now I'm doing very fast movements to remove scleral fibrosis, and that in a way is polishing your sclera like a marble. Does that make sense? But I'm doing it with a very sharp instrument. At the same time, I'm doing it in a very fast move so I don't cause any damage or remove any tissue. Does that make sense? And we have already removed your pinguecula. As I told you, every pinguecula has a leash behind it, which is what we did. We went after the iceberg concept, right? Comfortable? And for doctors watching is a wonderful nurse who has traveled here for a pinguecula treatment, and we're doing all these cases today with the human amniotic tissue. And now I'm just cleaning up the sclera to make it sparkling marble white, also because of removing subscleral or suprascleral fibrosis. You see how we have arranged her conjunctiva and tenons here. You can actually see the differentiation between the two right there. See that? Tenons and conjunctiva, the pocket I call it. And that's where we put our mitomycin. So now, I'm putting mitomycin C. Remember the medication? It's like a chemical that will further take care of things that I surgically may not be able to reach because it's microscopic, right? But I do it very safely without exposing your sclera. That's why we don't have scleral melt. It's between your conjunctiva and the tenon, the area that I opened up, the pocket that I call it. And therefore, in fact, that is the area I believe pterygiums come out of. Afterward. And there we are again. So we're putting it in the pocket, not on the sclera. Very important. And then after 20 seconds, I'll be taking that off and then doing a wash through. This medication actually is an anti-cancer medication, believe it or not. Mitomycin, right? Here now, I'm holding them together, the entire area, making sure they're inside that pocket, and I'm going to take off the excess from the sclera, once again preventing the sclera from getting in the space. Make sense, Yvonne? Even the patient before you, I had done previously, he was a plastic surgeon from Germany. And he read my entire book and came in. Can you believe it? Then he was making sure I'm following my own steps. Taking them off. 1, 2, 3, 4. And now I'm taking the amniotic graft, placing it on your eye. Amniotic tissue and placing it on your eye. There we are. Lovely. And now I'm putting glue under your amniotic graft. This is my sub-amniotic technique, so you don't mess around too much. What I'm doing now is just checking to make sure our graft is stuck well with the glue. Alright? And I'm removing the excess from the side so there is no inflammation tomorrow. Just wanting everything to be the way I want it to be and look, and making sure we've taken care of more than just this issue and corrected your anatomy forever. That's also very important. Comfortable? Yes. And now we remove the excess membrane. Ready? 64. Thank you. I'm being very particular, removing just the excess of everything perfected the way I want. Perfect. There we are. Everything's 55 now. Miss Nurse, did I give you a lesson in nice pterygium pinguecula surgery? Yes? Yvonne, we're all done. Look to your left. Look to your right, straight please. So you can see doctor is very well adhered. Amniotic graft, a completely clear cornea, and we are all done with surgery. Miss Nurse, congratulations.
Thank you very much.
It's been a pleasure. Congratulations. Safe travels back. My pleasure. You can see that doctor right immediately post-surgery. You can see the area completely clear, amniotic graft sitting with glue, right? Oh. It's a wonderful nurse, and we talked through her entire surgery. Look at her. Here she is. This is day 1 post pinguecula surgery. Chin over here, please. We used our no-stitch amniotic surgery for her. How's the eye feeling?
It's feeling better now.
This is a wonderful nurse. She's traveled to us for her pinguecula surgery, medial in the eye. And doctors, as usual, I'm always enamored by this work. Look at that, and the beautiful medial caruncle and fold that I create in the cornea, crystal clear. Eye looks perfect. No evidence of surgery. And the amniotic graft is sitting right there with glue, as you can see there. This is the amniotic graft sitting with glue, perfectly molded to her eye. Beautiful. And now, doctors, for my over 3 decades, I've been having my Pinguecula Pterygium patients walk up to the mirror next day. And this is important more for doctors than for patients, is to show, as a surgeon, I believe, the confidence of letting the patient go to the mirror next day. That to all these patients who come here are extremely intelligent, mostly nurses, doctors, and she's a great nurse too. Yvonne, go to the mirror, take a look.
Oh, wow. I haven't seen my eye like that in a long time.
Yes, Yvonne? How does it feel?
It feels good. Thank you very much, doctor.
Absolute pleasure. Absolute pleasure. Be an amazing teacher too, besides a nurse, right? Show patients and doctors everything, because that is the true accountability of work. Remember again, how you're healing, I can't guarantee. What you're going to say in the mirror, I don't know. There's no incentive for y'all, but I've been doing this constantly to inspire doctors to do this. Because once you get confident to let the patient go and judge for themselves, you become a better surgeon, right? A better doctor, a better healer, those kind of things.
Right.
Yvonne, you'll be the best.
Thank you.
Best nurse, right?
Thank you, doctor.
That's a pleasure.
Hi everyone, my name is Yvonne and I came in for Pinguecula surgery just a couple days ago by Dr. Gulani, and I've had a great experience so far. I've had 2 other consultations with doctors where they said not much can be done. I was given just prescriptions for steroid drops. And I even went to another institute down in Miami, well-renowned, and I had the same experience where they just kind of turned me away and said not much can be done due to pinguecula, mostly cosmetically, the procedure. So here, I got it taken care of and it's been lovely. I really had a large lesion to the left of the inside of my eye, and with large blood vessels that were always visible, and now I can't see them. They're not visible anymore. The surgery took about 30 minutes or so, and it was done really well. So I have to say that I've had a great experience. The doctor is wonderful, and I'm very, very happy and pleased to be here.
Okay, here we go. Now the Mona Lisa leaving. Yvonne, be an amazing nurse. It's a pleasure, absolute
Thank you,
pleasure.
Dr.
Absolutely. Patients from all over the world, of all ages, sex, and race, have experienced such cosmetic outcomes documented in our publications, including in our textbook, thus raising the bar on cosmetic outcomes of pterygium surgery. Thank you.